Hi guys, this video is designed to take you through two other staphylococcal organisms, Staphylococcus epidermidis and Staphylococcus saprophyticus. Several other staphylococcal organisms are mentioned in your notes, and you can find sufficient detail on them then. The Staphylococcus aureus video is a beast, but if you've already watched that one, this one's going to be a lot easier. Okay, so once again, we're still dealing with gram-positive organisms. These are also gram-positive cocci, and occasionally they do still also form those grape-like clusters when you look at them in culture. So just like Staph aureus. Unlike Staph aureus, though, these guys are actually colorless colonies on blood augurs. So remember that Staph aureus gives you that kind of like golden hue, hence aureus, which is the root word for gold. This one is colorless. Well, both of these are colorless, epidermidis and saprophyticus. These guys are also pretty ubiquitous. For example, specifically epidermidis. I think you guys could guess where it could go, where it grows, but just in case you couldn't, I wrote it right there. It lives on our skin. So we can kind of run into them anywhere. Characteristically, it's also beta hemolytic, just like Staph aureus. So how are we going to tell them apart? We're going to tell it apart with coagulase. But first we need to differentiate it once again from the streptococci. Recall that the streptococci are also gram-positive organisms, and they are also cocci. So very similar to the staphylococci, they're going to show up as those royal purple balls anytime you look in culture. The strep are more likely to form pairs and chains. Staph more likely to form these grape-like clusters, but you can't necessarily use that. So how are you going to tell it apart? Catalase. Remember that catalase converts basically hydrogen peroxide to oxygen and water. So staphylococci have them, streptococci don't. So all the staphylococci are catalase positive. Once again, we're the main reservoir of these. As I mentioned, Staph epidermidis lives on our skin. We're also the main reservoir for Staph saprophyticus. Okay, and also, just like Staph aureus, there's kind of a variety of extracellular products that can be either enzymes or toxins that we should keep in mind. I already went through catalase. Staph has it, strep doesn't. How do we tell it apart from Staph aureus? Well, the Staph saprophyticus and Staph epidermidis are both coagulase negative. In fact, Staph epidermidis is oftentimes referred to as coagulase negative staphylococcus. So that's one way that we can kind of be certain that we're talking about an organism that is not Staph aureus, that is a staphylococcal organism. It's gram-positive, so that means it has those teichoic acids, and those are really good for adherence, right? It also has lipase, so about 30% of the coagulase negative staphylococci will have lipase, which basically means they're capable of breaking down fats. So that's one of those extracellular toxins or extracellular enzymes that's good for invasion. As far as toxins go, it produces a delta toxin. Staph aureus, Staph epidermidis, and Staph hemolyticus produce this delta toxin. The delta toxin is cytolytic. It acts as a surfactant. Basically, it works like a detergent, lysing the cells. So as far as how it actually works, though, to cause disease, well, Staph epidermidis forms biofilms. This makes it kind of the enemy or the antagonist to orthopedic surgeons because it often infects prosthetic joints. Anytime you're setting a prosthetic joint in a patient, this is something that you're going to want to be a little bit concerned about. Once the implanted hardware has Staph epidermidis, it can be a bit of a problem. And I mentioned prosthetic joints, but that could also include things like catheters and other instrumentations. Since Staph epidermidis is everywhere, it kind of makes sense that anytime you're penetrating the skin, you're potentially introducing Staph epidermidis. So even if you're putting in a central line, well, you're putting in a line through my skin, Staph epidermidis is on there, so that's potential. You can also get endocarditis with this, with any implanted heart valves. So what exactly is a biofilm? A biofilm basically just means that this organism is really great at clumping together. So it's going to stick together and kind of form these sheets that will not only allow it to grow on things that it shouldn't, but also will provide a little bit of protection from antibiotics as they kind of layer over each other, as I'm making all of these squiggly lines that are becoming more and more tightly intertwined. So that's pretty much what we went over for staph epidermidis. Basically, it's going to cause infection of prosthetics and catheters, and it also causes endocarditis. So specifically, remember the endocarditis, we're mainly worried about prosthetic valves, but again, you're always going to worry about patients with weakened heart valves or some history of heart disease. And that's just a result of the biofilms. It's also a common contaminant of blood cultures whenever blood is drawn. So you really need to adequately prepare skin prior to drawing blood, because its presence on a blood culture is not necessarily indicative that it is the cause of infection. S. saprophyticus is actually a common cause for urinary tract infections. That's kind of where we worry about it or see it the most. Treatment. So how are you going to treat it? Well, it's a common contaminant. So first off, prepare the skin to be sure that you're actually looking at an S. epidermidis infection. It is novobiocin sensitive, so that's one way actually you can tell these two apart. So remember, both of these are coagulase negative, so that differentiates it from Staph aureus, but not from each other. So S. epidermidis is novobiocin sensitive, where S. saprophyticus is novobiocin resistant. So that's how you can tell them apart on a plate. And the way you're going to treat it, vancomycin. Vancomycin is generally the recommended treatment there. That's all I have on these remaining staphs.